Welcome back to my channel, English for Nursing Communication 2. I am Ruffel Manalo from the Faculty of Nursing, Nakhon, Pathom, Rajabhat University. So I'm going to discuss to you Unit 14. This is how to communicate with patients in the orthopedic part. So once again, this is a team teaching course by the three of us from the Faculty of Nursing. So for the objectives, at the end of the course, student nurses should be able to identify the types of orthopedic surgeries, apply the peri-operative management and nursing care, apply the post-operative management and nursing care, answer the practice test in a separate worksheet. So for the overview, orthopedics aims to treat the problems of the musculoskeletal system that includes our bones, our joints, our ligaments, tendons, and our muscles. And also orthopedics care involves a team approach performed by surgeons, nurses, and physiotherapists. So these are the three most important persons in the orthopedic department or orthopedic treatment of patients. So we have certain types of orthopedic surgeries, and the first here is the open reduction. For the open reduction, this is the reduction and alignment of the fracture through surgical incision. We also have closed reduction. This is the manipulation of bone fragments or joint dislocation without surgical incision. In internal fixation, this is the stabilization of the reduced fracture with the use of metal screw, plates, nails, or pins. In bone graft, this is the placement of autologous or homologous bone tissue to replace, promote healing of, or stabilize diseased bone of the patients. We also have arthroplasty. Arthroplasty, this is a repair of a joint, may be done through arthroscopy, or open joint repair. Joint replacement. So this is a type of orthopedic surgery, a type of arthroplasty that involves replacement of joint surfaces with metal or plastic materials. Total joint replacement. This is the replacement of both articular surfaces within a joint. And we also have meniscectomy. This is about the excision of damaged meniscus or fibrocartilage of the knee. So these are the types, right? We also have
meniscectomy, meniscectomy, meniscectomy.
So let's discuss types of orthopedic surgeries. So first here we have open reduction. This is the reduction and alignment of the fracture through surgical incision. Closed reduction. This is the manipulation of bone fragments or joint dislocation without surgical incision. Internal fixation. This is the stabilization of the reduced fracture with the use of metal screw, plates, nails, or pins. Bone graft. Bone graft is the placement of autologous or homologous bone tissue to replace, promote healing of, or stabilize diseased bone. Arthroplasty. Arthroplasty is repair of a joint, may be done through arthroscope, or we call it arthroscopy, or open joint repair. Then we have joint replacement, type of arthroplasty that involves replacement of joint surfaces with metal or plastic materials. Total joint replacement. So this is the replacement of both articular surfaces within a joint. Meniscectomy. This is the excision of damaged meniscus or fibrocartilage of the knee. The next one here is the tendon transfer. So this is the movement of tendon insertion point to improve function. So we also have fasciotomy. This is the cutting muscle fascia. The cutting of the muscle fascia to relieve constriction or contraction. Amputation. Okay, amputation. This is removal of a body part, usually in the legs or in the hands, in the limbs of the patient. So the pre-operative management and nursing care is almost the same with the previous topic that we have discussed about surgery. So we let the patient become hydrated, increase protein intake, and increase caloric intake as needed. Okay, that is part of the assessment score. This goal is to maximize or increase the healing and the reduction of complications by providing intravenous fluids, vitamins, and nutritional supplements as indicated by the surgeon. And if a patient also has had previous corticosteroid therapy, it could contribute to current orthopedic condition, and we call it aseptic necrosis of the femoral head or osteoporosis, as well as affect the patient's response to anesthesia and the stress of surgery. They need corticotropin post-operatively. So this is subject for some patients. And also for the evaluation, so we have to evaluate aspersis. We have to evaluate the signs of infection, and these are cold, dental, skin, UTI, which would contribute to development of osteomyelitis after surgery. So we always check, we always monitor the status of the patient's foot after surgery. And it is important also to determine whether preoperative antibiotics will be necessary. So usually when an antibiotic is given to the patient, they are given prior to or few hours before the surgery procedure takes place. Also, we have to evaluate the coughing and breathing exercises, frequent vital signs monitoring, and wound checks. Repositioning are described to prepare the patients. For some patients, they are not allowed for repositioning because some patients may have the complications to increase the injury to a certain part of the operation. Okay. So the patient should also practice voiding. Okay, urinate in the bedpan or urinal in a recumbent position before surgery. So this helps reduce the need for post-operative catheterization. The patient is acquainted with traction if they need to, apparatus, and the need for splint or cast as indicated by the type of surgery. In a review discharge or rehabilitation options for patients after surgery. So for the post-operative management and nursing care, okay, neurovascular status is monitored. So not only the neurology system, but also the circulation of the tissue. Swelling caused by edema and bleeding into tissues needs to be controlled because it will develop to another complication, another problem in the long run. The affected area is immobilized, so take note of this, and activity limited to protect the operative sites and stabilize musculoskeletal structures. Hemorrhage and shock, which may result from significant bleeding and for hemostasis or hemostasis of muscles which occur with orthopedic surgery are also monitored. Complications of immobility are prevented through aggressive and vigilant post-operative care. So some patients need to mobilize, some patients does not need to mobilize. So take note of that. So to conclude, okay, ultimately, perioperative nurses are always challenged to provide optimal care for patients receiving bone surgeries or treatments, and at some point, a complex intervention covering all stages of the patient pathway with the incorporation of patient choice and individualization of therapies. So I hope you got something from our lecture session. Thank you very much for your attention, and if you have any inquiries, please don't hesitate to send me a message through my email, line, and messenger. Till next time.